and thank Dr. Winkelstein and his team for taking the time to prepare for this, and being so generous, not only with their time today, but for everything that they're doing across the health sciences. I think Dr. Winkelstein established the Institute for Healthcare Informatics a number of years ago and has been leading it beautifully since then. And yet at the same time, it seems that they certainly don't get enough attention or recognition for the work that they're doing. They were kind enough to share with me their just their user list, and I think that there's so many opportunities for investigators to actively engage with them because of the resource that they are. And so that's the purpose of today's conversation. So on behalf of Dr. Bashir, Vice President for Health Sciences, and our office, Peter, thank you so much for taking the time to do this. I am happy you tell me what you would like me to do as far as moderating. Do you want to take questions as you're going, or would you prefer just we hold till the end and then people can put things in chat or raise their hand?
Yeah, why don't we do it that way? So the way we'll go ahead and do this. So thank you very much for that lovely introduction, Jill. Greatly appreciate it. And appreciate this opportunity because, as you mentioned, what we thrive on is attention. Recognition is nice too, but what we really thrive on is attention, because that's what we do is we try to support the research endeavors of the university, and so we want people to know about us and to use our facilities. So what we're going to do is I'm going to do a slide presentation, kind of giving you an overview of what we provide, what we do, and how to access those services and the data that we hold. And then Jonathan Blazier, who's our lead DBA for the IHI, and basically really does all the work. I don't do anything except talk, but he does the real work. He's going to give a demonstration of how actually you can use our query tools, TriNetX, our query tool, to look at the data that we have for yourself. So that's will be the structure. Be very happy to take questions. I think at the end, throw them in the chat or raise your hand, and we'll take them at that point. So with that, let me share my screen. Okay. I can't. Oh, yes, I can. Sorry, for a moment I thought I didn't have it here, but I do. All right. With any luck, you've got my presentation there. So let me just dive right in.
We do see it.
Great, thank you. So just this is our mission, which I mentioned before. We're here to support research at the university, and like all of us, our goal of the research is to improve the healthcare for our community and beyond. And so that's we're trying very much to enable that as best we can. Our vision on this, I'm sorry, I'm just going to move the little pictures over to here so they're out of my way. Great. Our vision is to provide access to a comprehensive database, and I'll talk a little bit about the data that we have in just a second, and allow researchers to access that data in an efficient and easy way with end user tools. In other words, tools that researchers can use to look at the data themselves. We're here to provide analytic support as well, but our goal is to enable you to be able to look at the data for yourself and get a chance to see what's in there for yourself, and help inform your research decisions. One of the things that really is important for us is that we have a very good relationship with our healthcare partners, with the UBMD practice plan partners, and with Kaleida Health, and also with ECMC. We have a very good relationship with them, and that allows us to be able to provide much of their data to you as researchers. Oops, sorry, I'm going too fast here. Just brief history. We started in 2012, so where am I up to? 13 years ago? No, 11 years ago. No, it's what is 2025? 14 years ago, 13 years. I was right the first time. I can't do any addition today. I apologize. About 13 years ago. And with funding from New York State, and then additional funding in 2014 also from New York State to expand out into genomics as well. We partnered with TriNetX, which is a commercial entity in 2016. They've since become the leading, or certainly one of the leading entities that helps universities and other organizations work with data specifically to support industry-sponsored clinical trials. That's actually, they work as a middleman typically between pharma and universities to allow universities to participate in industry-sponsored clinical trials. But they've expanded to provide a very robust query and research environment for universities. So that's been a great partnership that we've had for quite a while. And we have from the very beginning been part of helping out the CTSA, the CTSA award and the CTSA efforts to promote translational research here at UB. What we have at the IHI and the data that we have for you at the IHI, what we provide for you at the IHI is we provide access to local EHR data. I'll talk exactly what that is in a minute, but basically data on patients and people that are here in Western New York. So we have a great deal of EHR data about our community, and so we provide access to that. We also have access through TriNetX to very large global data sets for EHR data. And then we, in addition, provide secure storage and compute. Some researchers have asked us to store their data because we have a high security storage and compute environment. I should mention that the local data we hold fully identified. Now, most researchers don't need fully identified data, but often you need some identifiers. So fully de-identified data is sometimes not sufficient for much of the research that we work with. So we have fully identified data for our local population. The TriNetX data, the global data sets, are what's called a limited data set. So it's not fully de-identified. It has some identifiers in it, but is not fully identified. What we have here for our local population is we have the data from the UBMD faculty practice plans, EHR. So that's outpatient data. We go back, John would know better than I would, at least 10 years. And we cover about 800,000 patients in that data set. This is, again, fully identified data that we hold securely for research. We also, in our partnership with Kaleida, have both acute inpatient data and outpatient data for close to 1 million patients, also fully identified. I believe that goes back 5 or 6 years. And then we have some claims data as well, partially identified for a large portion of the population. We have linked the EHR data together so that we can follow a patient between the data sets. So in other words, if a patient is seen at UBMD and then seen at Kaleida, we can connect those records so that you can query across a patient's healthcare journey, if you will, if you want to be able to ask questions about how a patient's health as they move among these organizations. We are continuing to be working with ECMC for their data as well. They very much want us to have their data, and we're working out the legal agreements. So hopefully at some point in the nearer future, we'll be able to provide you with ECMC data as well. And this is just a little more detail of the data that we've got and the data volume that we have. So given that our catchment area in Western New York is a little over 1 million, maybe 1.5 million patients, you can see that we have data on most of the population here in Western New York. So a very good view into the health of our community. It's unusual for a data repository such as what we have to have such a comprehensive view of the community. And that has to do, of course, with the fact that we have a community and we have healthcare systems that cover a lot of it, and we've been able to collect that data. So we have a fairly comprehensive view of the health of our community in the data repository. Our process, if you're looking at data or want to look at data, our process is pretty simple. Essentially, you would use our end user query tool, TriNetX, which is what we're going to demo a little later this afternoon. you would use our end user query tool to iteratively develop criteria, ask questions about the data. Now that's done in a fully de-identified way, so you can't actually see individual patient data, but you can ask aggregate questions. How many patients with asthma are coming to the emergency room and are on an inhaled steroid or not on an inhaled steroid? I'm making up this example, obviously. How many diabetics have hemoglobin A1Cs that are under control? What's their medication regimen? These are the kinds of questions that you can ask in this very aggregate way yourself using these end user query tools like TriNetX, and we'll show you examples of how to do that. Once you identify a patient cohort for which you want more detailed data, so data that might involve identifiers, for example, but basically a data set for a specific cohort of patients, that's the point at which you need your IRB approval. We only provide data with an IRB approval associated with it. So you would develop your IRB approval, get approved for that. And then what we would do is we would extract that data set based on your queries. We would extract that data set and put it in a secure area at the IHI. And then you would remote into the IHI on your own virtual machine, basically on essentially your own computer in the IHI, and then be able to do whatever analysis you want to do. We would load up whatever software it is that you want on your computer there at the IHI, and then it's held totally securely. You can do your analysis right there. So that's the basic idea. You're doing your querying, you're identifying your patient cohort, you're getting your IRB approval to see the data on that cohort, and then we're providing the data set based on that. Now, one of the things about EHR data is that EHR data that we have in the IHI is typically structured data. In other words, it's elements that are coded, a coded diagnosis, a lab value, something like that. But also in EHRs, as you know, in electronic health records, as you know, there's uncoded data, there is unstructured data. There's mostly that sits in things like clinical notes, which is just typically free text. And sometimes you want to be able to ask questions about what's in that free text. And that's a more complicated query. Of course, with coded data, it's relatively straightforward to set up queries greater than this, less than that, within this range, these particular values. But in free text, it's more difficult to search through that. So we've developed a query tool that allows for searching through the clinical notes based on a number of criteria: text, type of note, these kinds of things. Now, because clinical notes are unstructured and sometimes have identifiers in them, we can't allow individual researchers to just look at the clinical notes. So we have to do these queries for you. So we will work with you as a service to help query the clinical notes and then identify patients who have particular terms or particular items in the clinical notes and identify a patient cohort that way, at which point, again, with your IRB approval in place, we would be able to extract the data that you need for your research and set that up for you in your own computing environment at the IHI. So this is a service we provide. So if you want to ask questions of the clinical notes, we would work with you to help search through the clinical notes. And we've done this for a couple of researchers who have in particular been looking for diagnoses that for which there isn't a good code. So if you're looking for a patient who has a particular condition, but there's not a good code for that, really the only place you're going to find it is in the text of the clinical notes. And then I mentioned our global EHR data sets that we have through the TriNetX Research Network, of which we're a part. And this is some example of the data sets that are there. And you can see the size of these data sets, basically something like 250 million patients in some of them. And these different data sets cover different areas and have different foci. We can talk about exactly what each data set does if you're interested in these things, but this allows you to ask questions of an extremely large patient population that is both, some of it is United States, but a lot of it is global. This is in a partially de-identified, another limited data set format, and through TriNetX, you can get de-identified data from them, from these networks as you query them. But you would use the same tool, TriNetX, the same one that we're going to show you. You would use that to query these networks. You can also use that tool, of course, to query our local EHR data. But this gives you access to a very large set of patient data from, again, both US and global to be able to look at and ask questions of. To get this data, basically very similar to the way you would get data for the local EHR, you're going to use TriNetX to query it. And then once you've identified the patient cohort for the data set that you want, that request actually goes into TriNetX rather than to us, but you will do it through us. We vet to make sure that you have the appropriate IRB approval for that, and then TriNetX would release the data set to you. And then lastly, I want to mention our secure storage and compute environment, which we use, of course, as a place to put the data sets so that you can securely analyze them and they're securely held at the IHI. But because we have that secure storage and compute environment set up, we can also make that available to you for your own data if you wish. If you have sensitive data that you feel uncomfortable storing in your own computers, and typically sensitive data, you want to pay a lot of attention to that. We can provide secure storage and compute environment for you. And Dr. Noyes, I saw that Katja, you were on, is one of the people who's been using our secure compute environment extensively. And that's allowed us to be able to hold the data and be able to convince a number of organizations to allow us to hold the data because we can show the level of security that we have for the data. Now, how do you get at this? Very simple. Go to our website, which is part of the CTSI recently redesigned website. Thank you, Naveed, who was also on here. Did a beautiful job redesigning the CTSI website, and you will find the Institute for Healthcare Informatics right there. You just find us there on the main menu. Go down and find services and support as one of the choices, and then you can easily fill out a request. Probably your first request is to ask for a username and password so that you can access the data in a de-identified way. In other words, access TriNetX. We usually turn that around quite quickly. And as long as you have a UBIT, buffalo.edu address, there's generally no question about giving you the username and password. And once you have that, you have access to TriNetX and you can start asking questions of the de-identified data. We're a relatively small operation, but small and mighty. And this is our team who all do a great job, very dedicated to the operation. And again, we're here for you in order to be able to provide you with access to this data and access to the services we provide. And so with that, I'm going to stop sharing. No, okay. One question is, are we charging you anything for the service provided regarding the clinical notes? No. We are not charging for that. The only time we ask for that there's a charge per se is if you have a funded research project that is using the IHI data. We do ask for a budget line in when you put in for a funded grant. It's a very modest fee. We essentially charge along the same lines that UBCIT, the IT operation for the university, charges for their compute and storage, which is very modest. But we do ask for that if you are putting in for a funded grant. But other than that, there is no charge at the moment. All right, let's go on to Jonathan, who will give us a demo of how TriNetX looks and how it works.
Sounds good. Yeah, I'm sorry I'm on a little bit of a limited internet connection today because they decided they were going to do some work on my internet line. So hopefully we can see my screen okay. Is that?
Yep.
All right, great. I'm actually going to kind of go back out of this so we can kind of see it from the beginning. So once you get your login to TriNetX, it'll send you a link in your email, and you'll click on that, and it'll go through the process of setting up your account. The IHI does set up the account. They give the permissions and all the things that you would need to log in. But TriNetX does handle all password resets and anything like that you would need. It's very simple. If you ever need to reset your password, there's just a link here, and you would follow the instructions. But let me log into my account here. It will look a little bit differently once you get your login because, of course, I'm an administrator. But what I'm going to do is go to what I have here is I have some open queries that I've worked with other researchers with. I'm going to go into a demo study. But if you wanted to create a new query, you would come up here to the create new study and just fill out some basic information. It doesn't have to be, just so you can define, what query it is. It doesn't really matter what you use. I'm just calling it demo study here. So once we're in the actual study, this is where you will build out some queries to identify your patient cohorts. There's a couple things I want to point out here. TriNetX has this concept of networks. So University of Buffalo is a network. So we're the data that we actually put into our database, our data repository, is on the University of Buffalo network. If you click here, you can come in and see all the different networks that are available to you. Now, Peter explained a little bit about some of these national networks or even international networks that they have. And some of those numbers, they've been expanded. This is constantly being updated by TriNetX, but there are very good resources. These data sets here will only be that limited data set. You can still request the data. Depending on what you're using it for, you'll still have to either get IRB waiver or not human subjects research determination from the IRB. And then once we have that documentation, we're able to release the data set. And you do that by requesting a data set up here. Getting a little ahead of myself there, but I just wanted to kind of point that out. The University of Buffalo network is our fully identified data set. We have all of this information securely. The information that we send to TriNetX is a limited data set, but once you identify your patient cohort, we are able to match it back up to the identifiers in our database. So if you need other things that are not provided in TriNetX, we can pull that patient information out for you. For this one, I'm gonna use University of Buffalo. I have a little query set up here, but I want to kind of delete it and show you how I built it. So the whole concept of this is inclusion-exclusion criteria. It's very, very simple to use, very easy. You just start typing the term that you're looking for. So for example, diabetes. It has the whole coding system. So this is, of course, ICD-10. So you can expand and dive into the different trees and get very specific if you want to. Let's see here. Let's see. Type 2. Okay. So I'm going to do a query. We're going to look for our type 2 diabetes patients. Right now, you can see that each of these terms, they also have a patient count associated with them. So you can see right now, if I have about 57,000 patients with diabetes type 2. So I'm going to add that to the query. So one of the strategies we use is we'll try to have a multi-pronged approach when we're looking for patients. Sometimes they're not coded appropriately, or maybe they're using the wrong code, or it's just not even in the database. So I'll do things like look for A1C value. So hemoglobin A1C. I'm going to use the link code, which that's the lab coding system. I'm going to choose that, add to query, and then you can do things like greater than or equal to, oh, I'm sorry, I don't want to do age range. I want to do select lab value range. Greater than or equal to, let's say 7%. It's nice because it shows you the curve of the patients, and you can kind of be very specific on where you're looking. So let's do 7% or greater. Now, if I run this query, so you see here you have a little exclamation point. That means that the query has not been refreshed since I changed the criteria. So let's go ahead and refresh that. So I'm getting about 20,000 patients. As you can see, though, I'm looking for type 2 diabetes and they have an A1C greater than 7. We can come here and say, or, and try to get cast a wider net, right? So let's refresh that. Now we have about 70,000 patients. Okay. Now let's say it's even more specific, and we were looking for diabetes patients that do not have hypertension. So I'm going to say, do not have hypertensive. Refresh that. Now I'm down to a 30,000 patient population. Now, once you have your query built, and you can get very complex with this, and I'm more of the mechanic, not the guy that drives the car, but you can get very complex with this. And TriNetX is very good about questions, and they have a lot of material that you can go into. They have a very nice help center where you can watch some training videos, how-tos, and really dive into what this application can do. They've done an excellent job of making this available and very easy to use, in my opinion. Well, we can certainly help you with any questions you have. But what I like to do after I formulate the query is we can go in here and explore the cohort. So I'm going to run the exploratory cohort function. It takes a few seconds for it to compute everything. But what this will do is this will give you some general dashboards on the patient population that you identified. So things like demographics, their diagnoses, the configuration of diagnoses in that particular population, procedures, etc. And I'm not sure if this is just taking so long because I'm on a very slow internet connection. Give me 1 second. Let's see if I can get it to kick off. Maybe I can go into the history and just show you some of the old runs. Yeah, let me go into the history. And I apologize. I'm again on a very slow connection. History is not showing anything either. So normally, what this would run, and then it will show you graphs of all the patients in your cohort. It'll tell you things like race, ethnicity, by percentage. It'll tell you age ranges. It'll graph out all these different things. So you can get a really high level overview of this population that you're looking at. Diagnoses, it'll group all the patients with similar diagnoses. It's a good way to understand your comorbidities in your population. Right now, we do not have oncology information. That is something that we are working to get, working with Kaleida. Procedures will be your CPT codes, medications, of course, being RX norm or NDC codes. We do populate all the labs with link codes, so you're able to see their distributions based on which labs you're looking for, just like the A1C that I just queried on. We do store the values in the ranges as well, so we know if a particular value is out of range for a patient. Genomics, that is a piece that we are looking to expand as well. We've been working with Buffalo Institute for Genomics very closely, and we've been trying to pull that information into TriNetX as well. Some complexities there, but we are working through them. Some of these others fields, and again, you can dive really far into this with the analysis program. And I'm not as familiar with this, but this is something where they released recently, where you can do some statistics and work on that patient query. Now, once you're finished and you'd like to do, proceed with your study, you found the patient cohort that you need for your study. There's a couple different ways of moving forward. One is, you need patient identifiers, you need a certain amount of information the IHI holds. So at that point, you would go and create a ticket to the IHI saying, I'm going to request this data set. And you would go to the IRB, and then you would get IRB approval. And you would upload that document into our ticketing system. We would review it, make sure everything looks good. And then we would create a virtual machine for you in our secure environment, allow you to log into that machine, and then provide you with the data set or any tools that you need. And Dr. Noyes, she's used this quite a bit for a lot of her projects. And we have a good system to be able to build out your whatever tools you need. If you're an R person, a Python person, SPSS, whatever analysis tools you need, then we provide those for you. And then that way that you don't ever have to worry about that data. It's always staying in the IHI. It's always secure. Now, the other mechanism is if you just need a limited data set, you don't need those identifiers, you're able to come over here and request the data set. Now, I talked about this a little bit before as well. The national data sets, the data sets that TriNetX provide, other than University of Buffalo, you can also use this mechanism to get the data. The difference is that whenever you ask for TriNetX data sets, we do have to go through some paperwork because TriNetX requires it. If you request the data set through University of Buffalo, it's as simple as myself and my staff making sure you have the appropriate documentation, and then we release the data set to you. Okay. Let me see if it's unfortunate I can't get this to work because this is neat. Oh, there it goes. Great. Great. Okay, good. So here, yeah. So yeah, you have your sex distributions, your race distributions, your ethnicity distributions as well. And then some nice graphs that just really kind of explore the cohort and to understand it more, before you start your study. Let's look at diagnoses. So 74% of the population has this ICD-10 code, and you can actually add these or say they must have this or they can have this if you want to filter it directly from here, so you can modify your query, which is a nice feature that they just added. Let's look at some procedures. So let's look at the top one. It's nice how it groups them too, because you can really drill down into it. Hemoglobin, of course, we queried for that. TSH commonly with endocrine disease, creatinine, all of these different values. You can see what the population distribution is. Medications, of course. Let's see here. Of course, you're going to get a lot of blood glucose regulation agents, insulin. I'm sure metformin is going to be in here. Yep. Right. 52% on metformin, type 2 diabetes. That makes sense. Right. And then, of course, your lab procedures, metabolic panels, CBCs, your liver functions, very common. Diabetics, of course. Lipid panels. Very, very detailed and still not having to have an IRB yet. So this is a great tool to explore your cohorts. Okay. And then let's do a summary of statistics. Oh, I got it to run also. So yeah, so this is going to get you kind of look at your length of the data you have for patients, all the different observation facts. This is actually a new screen. I've not seen this one before. They do have a distribution of patients, but I believe this is disabled at the moment because I think they were having an issue with it being de-identified. So that's something they're working on currently, but this is very, very new. So they try to add new features and ways to look at the data. So it's a nice little tool. Now the analytics tool, this tool can be very specific. You can analyze outcomes, compare different cohorts. You can create multiple queries and compare them to each other. So this is a nice way to do a pre-study, look at the different features of those populations. This is also a fairly new piece of the software that they've added. They have some good training videos on this as well. Okay. Now, is there any questions or things that they would want to look at closer? I'm happy to go into any details.
John, there was one question in the chat. You've got it open, basically saying, this is from Richard, when choosing not to have a specific diagnosis, I guess the question is, what does that mean in terms of excluding it? Richard, do you want to unmute and ask your question directly?
Oh, yeah. Thank you, Dr. Winkelstein. Yes. So just about just wondering, when we say exclude, does that means like if I want to build a cohort and so this patient may got a specific diagnosis like cancer, but if we say we exclude the cancer, does that mean like we'll just exclude this patient's like all the data like before that he or she get this cancer diagnosis, or just like at this stage this patient has cancer diagnosis, will exclude the data after the having this specific diagnosis? I think that's my question.
Yeah, that's a good question. So let me try. So there's a little bit of nuance here. So you can do things like say they haven't had cancer in the last 2 years, for example. They haven't had a cancer diagnosis in the last 2 years. And maybe that might not be a good example, but you can do temporal things like that, and then that patient would not. It would eliminate any patients that have had a diagnosis of cancer in the last 2 years from the data set completely. But if someone had it 4 years ago, for example, they would be in that data set, in that patient cohort. But yes, it's from the generic, in this case, cannot have hypertensive disease. It's any existence of hypertensive disease would remove that from the patient cohort. Does that help?
Yeah, thank you, Jonas, and thank you, Dr. Winkelstein.
Yeah, you're very welcome.
Great. Yeah, great question. There's another question here, which I think may have been answered by your demonstration, which is, do we have pediatric and adolescent data? The answer is yes. Yep, it's in there if we have it. Yes, I don't know if you can show demographics of the entire data set.
Yeah, give me 1 second. They keep moving it. It used to be right here where you would go. Oh, sorry, it filters here. Okay, so this is if you click on this, you can actually see right now it's any medical center type, any data type, any age, any sex. So you can go into this and edit it for age and sex, and then you could say greater than or equal to however many years, less than or equal to, and then also by gender. So
there you go. There's your age demographics right there.
Yep.
It's interesting. We got a dip, right? I guess people don't go to the doctor at that age. So I hope that answers your question, Marissa. Another question here. If you have a specific questions on potential research studies, I'm not quite sure what the question is. Michael, do you want to unmute and ask?
Oh, thank you very much. No, I'm very interested in, very, very much appreciate this presentation. I have some specific questions regarding physical therapy data, and I don't want to take too much time from the meeting. So going forward, is there a best point of contact we could email? Would it be you, Peter, or somebody else, just to kind of go through some of those scenarios?
Sure. If you've got questions about what data we have or how we might get it, yeah, absolutely. Feel free to reach out to me directly or to Jonathan. We both have buffalo.edu addresses, so we're right there in the global directory. Just reach out to either or both of us, and we'll be happy to set up a chance to either do it by email or talk. Happy to do that.
Absolutely.
Thank you.
Let's see. Dentistry, a question about, do we have any dentistry data? I don't think so. The dentistry data is typically on its own. It's a great question. The dentistry data is on its own EHRs, and we don't have access to the dental EHR data. I would love to have dental data.
Yeah.
So if we could figure out who might be willing to pass it on to us, and then we'd have to kind of figure out what it looks like, because I don't know anything. I'm a pediatrician. I don't know anything about teeth, except when they come in on kids. So I don't know what the EHR data for dentistry looks like, what the elements are, but I would love to explore that if there was interest in that. But no, at the moment we do not have any dental data from the dental EHRs. If there's any dental data, procedures or whatever that were done in the regular EHR, that would be in there, but not from any of the dental EHRs. I hope that answers the question.
Hi, Peter. I can maybe expand a little bit on that. This is Gunther Cohn. I'm at the dental school.
Yeah.
So we have a lot of records, I think just over 1 million patients. And we're hoping to, hopefully within the next year or so, be able to be in a position to export this data to different kinds of data warehouses like this one, we currently participate in a national data warehouse that only includes dental information. It's called Big Mouth. And so it would be great to actually join with the medical information at some point, and we're hoping to do that very soon.
Great. We'd be happy to explore that with you if that made sense.
Absolutely.
May I ask a side question here? Is what, if any, and maybe this is still under discussion, or maybe this is not something that you want to talk about in this forum, but what, if any, are your plans around the Epic project, whether or not that connects into the dental data?
We are very interested in the Epic project. The dental component in Epic is not super mature yet, so I think we want to kind of wait and see, and I think we're slotted in for the second round, potentially. So yeah, it would be great to actually, be able to participate without having to worry about, exporting data and, making it line up with medical information. But that is likely going to be some years down the road, because I think phase 2 of Epic is not for maybe 3, 4, 5 years or something like that.
Just I suspect most people on this call are aware of the fact that there's a big project in place to change EHRs, both for all for Kaleida, for ECMC, and for UBMD to go onto a common EHR, namely Epic. And one of the advantages of that will be hopefully that we will have easier access to data for research, because all the data will be in one place. Right now, one of the things that we have to do is take data from multiple places and put it together. Once it's in Epic, it should be much easier for us to take it from Epic and have it all in one place and ready to go. That's still a little ways down the road, but that's coming and that's cooking, and so we'll hopefully make it even easier to access the EHR data from this area.
Oh, and Peter, I see a question about using the national data set. I just wanted to show you exactly how. So this is the query I ran on the University of Buffalo network. You would just switch into your data set that you're interested in. Let's just do the global collaborative network, and then you would refresh the query, and it's as simple as that. Yep, it's the same exact features and functionality. The global networks usually will take a little bit longer to run, because of course this is how many, 174. Yeah, so we got about, what, 3 million patients back. So yeah.
So the beauty of these large networks is much bigger N. You have somewhat less data. So it's deeper but not broader, or maybe the other way around. In any case, a lot bigger N, but you don't have access to the fully identified data. So it depends what your needs are.
Taller and narrower.
Taller, and yeah, that's right. So it depends what your needs are, and also, of course, if you're trying to research the local populations, then of course you'd be interested in the local data.
Right.
Peter, can I chime in with a question?
Absolutely.
It's something that came up in a call that I received last week. Because you have access to Kaleida patient data, is there a way for investigators to come to your team and ask who within the Kaleida network, from a patient vantage, has participated in a clinical trial that they've also been engaged in? Do you have that data?
Great question. There is not currently, that I know of, a clinical trial flag in the EHR data. In other words, that information is not recorded in the EHR in a consistent way that I'm aware of. So we can only query on what data is there, and if the participated in clinical trial isn't a data element that we have, then we can't query on it. So there's not a simple way to do that I know of. Jonathan, does that anything occur to you?
We've kicked this one around for quite a while, and I think we were looking at some solutions with Cerner at one point, but I believe Epic will have this ability. That's from what I understand in some of the discussions, and that is something we will be pulling directly from Epic going in the future. But I think Cerner had a software, I think it was called Power Trials, right, Peter? Power
Yeah,
Trials?
which we
Yeah,
did
and
not
that was
implement in
never
our own
implemented.
mode. Yeah.
Yeah.
Epic
So we
is
don't,
much more powerful there, by the way. Epic has much better clinical trial support in the EHR than Cerner does.
Thank you.
I should mention, there's a couple more questions in the chat I'll get to in a second. I should mention that we basically see two types, if you will, of use for the data. One is what we've kind of been alluding to. I want to extract a data set and do some analysis. So come up with a patient cohort, get appropriate data elements for that, and do some analysis on it. The other is I want to identify a patient cohort for recruitment to a clinical trial or for chart review. So there I'm interested in identifying the patients, but I'm not going to actually necessarily look at their EHR data at the IHI. What I want to do is I want to go into the EHR itself and do a chart review or start reaching out to patients for cohort identification. And we can support all of that. So you just can reach out to us and we can support both of those pathways. Couple questions that came up here. One question is, can you reach out to somebody in our office for a request to run queries? We don't, aside from the clinical notes that I mentioned, we don't run the queries. You can do that yourself. This is an end user self-service tool, and there's lots of help available from TriNetX. But if you've got questions, you're certainly welcome to reach out. But this is designed for you, the researcher, to run these queries yourself. Obviously, if you've got questions about the data and things like that, we're happy to help in that way. But we're just not big enough, unfortunately, to offer a service to be running queries on request for the most part. We're just not a big enough operation at this point. Jill's going to fix that, right, Jill?
Of course, of course.
Thank you.
Sorry, I was looking for the mute button.
And then there's another question here commenting that UB doesn't have any inpatient data. Yes, that's correct. That is because the UBMD practice plans are outpatient only. So the only thing in the UBMD EHR is outpatient data because that's what the practice plan sees. All of the inpatient activity takes place at the inpatient facilities like Kaleida or ECMC, which is why it's in their EHR. So the UBMD EHRs are outpatient only, because that's the service that's being provided.
Yeah, and I want to comment on that a little bit. So what you're seeing in the dashboard right now, so TriNetX provides ways to extract some of the information from specific EMRs. Right now with Cerner, the inpatient data is in here. You're able to query it, but some of the functionality where they identify specific encounters and things was not developed in the Cerner extraction. That will change in Epic. We have a project right now that is working on medications that are prescribed during inpatient visits. We do have the data to do that internally, but some of the functionality in the query tool is not available just for those reasons. And since we're moving to Epic, the choice was made to concentrate on that effort to be better in the future than to work on something that is going away shortly.
So I'm sorry. So maybe I misunderstood the question. The inpatient data is available for querying through TriNetX.
Yeah.
Yeah. So it is there, even depending on what it says. I'm sorry, I may have misunderstood the question. I apologize. Yeah. It looks like we've caught up on the chat. We'd be happy to entertain any other questions if you want to come off mute or put them in the chat. I'm happy to entertain questions. And I saw the note that recording of this will be available on YouTube. Is that correct?
That is correct. We have our own YouTube channel. So please subscribe. Shameless plug.
Great. All right, if there's no more questions, then we'll let you go. Please, again, feel free to reach out to me or to Jonathan with any questions. You can go right to the website to get yourself a username and password, so you can start exploring TriNetX for yourself and start using the data yourself. We'd love to have you use it. TriNetX is pretty heavily used by our researchers, and we want it even more heavily used. So please give it a try and give us any feedback that you might have. So thank you. And Jill, thank you again for the invitation to do this.
Thank you, Peter. I'm sorry. There was one last question that just popped up, if you could, for a second. Is there any data related to rehab services, PT, OT?
And speech language. I don't know the answer to that. Jonathan, do you know?
I don't think so. It depends on if the provider is recording the information. I don't know if any of those services are being documented specifically in the EMR.
Can you
That's
do a
something we
quick,
could
can you
look
do a
at.
quick query and see if you can find physical or occupational therapy? Because it is inpatient physical and occupational therapy would be recorded there. And now outpatient, Kaleida outpatient PT and OT is now on Cerner as well. I don't know if we're getting that data.
So there's physical therapy evaluations. So here, sorry, this is a little bit out of my realm of expertise, fortunately. So yeah, I mean, it looks like we do have some. I think if you had a bunch of, if you had some codes that you wanted me to query on, I could certainly look up those. And
Yeah, I see this other comment here about impact. Yeah, if it's in the Kaleida EHR, we may have it. I mean, it should come over. But there sometimes are nuances to how the data is transferred. So it may be something that you want to get onto TriNetX and start poking around and see what's there. That sometimes is the easiest way to do it, is to actually go take a look and see what's come over and see what might be there.
yeah, you can either search by using just regular text, or you can search by specific code. Absolutely. Yeah, ICD-10, Loink, RX norm for medications, CPT for procedures, other CPT kind of encompasses a lot of different things.
Yeah. Generally, that's the really optimal way to do it, is if you know the codes you're after. The text type searches there are for, not everybody knows. When you say everybody knows what asthma is, but how many people know what the ICD-10 codes are for it? There's a variety of them. That's the kind of thing that could be helpful if you just put in asthma. But if you know your ICD-10 codes that you're focused on, absolutely go for it, or CPT or whatever.
Yeah, because the CPT will relate it to the service provided, which links it to the discipline oftentimes. So
yeah,
excellent. Thank you so much.
Yeah, give it a try and see. Be interested to know what you find.
Yeah. Oh yeah.
And I think home health is probably done in a separate EMR. I don't know, Peter, you might be able to ask that question. That might be in the physicians group, right?
Well, things like services provided by the VNA and such are on their own EHR. We don't have that. So if that's where it's being recorded, we wouldn't have it. So yeah, I doubt there's that much with home health in the EHRs, but I'm not sure how everybody is doing home health. And if they are recording some of that data in the UBMD EHR or the Kaleida EHR, it might well be in there. Again, you'd have to poke around, but I do know that organizations like the VNA are using their own EHR. We don't have that.
And I imagine some of the shared risk care is being done externally too, right, Peter? So that's going to be Kaleida has a physicians group that they work in MedEnt, I believe, right?
Yes, we do not have access to the MedDent data from Kaleida, which is GPPC's EHR. We do not have access to that.
Sorry, I couldn't think of the acronym.
Yep, yeah. It's just a bunch of letters.
Yep.
Well, thank you both very much for taking the time to prep for it, and for the great presentation. Very much appreciated.